and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Good evening, everyone. Welcome to another episode of You and Your Doctor. I'm with All County Healthcare. We are a Medicare certified home health care service that services Palm Beach County, Broward, and Miami-Dade. We can be reached at 954-717-7027. Again, I'm your host, Louise Gomez. Welcome to another episode. And today we have Dr. Paul Winner. I hope he can hear us, and he's on. He is at 4631 North Congress Avenue, Suite 200 in West Palm Beach, Florida, 33407. Telephone number is 561-845-0500. Thank you so much for joining us, Dr. Winner. How are you today?
How are you doing today?
I'm doing well. I appreciate you coming on to the show, and I know you have such an amazing bio, and it was just too long to read. You are just doing remarkable things. And can you tell us a little bit more about the Premier Research Institute and a little bit more about yourself?
Happy to do so. I'm very lucky to have an incredible team behind me. I am the director of the Premier Research Institute, which is part of the research division of Palm Beach Neurology, as you stated, in West Palm Beach, Florida. As a senior director, I have been doing research for over 25 years in clinical practice and clinical research. Right now, a large part of the focus of our center is in the area of memory loss issues, essentially mild cognitive impairment, Alzheimer's, dementia has been the key focus. We have some other areas, Parkinson's as well. Our focus is to basically try to solve the problem of these disorders. We have done some amazing studies over the past 25 years. We've been instrumental in getting the approval of the two most recent medicines for the treatment, and I said the treatment of Alzheimer's. It is a disease-modifying treatment, means we slow the progression of disease. Those two medicines are getting to be very familiar, aducanumab and lecanemab. Mm-hmm. And we are also doing a lot of other research, not only with those monoclonal antibodies, which are continuing, but some of the newer monoclonal antibodies that deal with this horrible disorder that we are finally getting a good handle on with regard to what it is, how it progresses, and most importantly, how to prevent it and how to slow its progression. And ultimately, a cure is a little further away, but treatments are already here and they're coming very quickly. I'd like to talk about some of that later today. But again, I don't do this alone. Dr. Carl Sadowski I've been partnered with for many years. We have 8 board certified neurologists in the practice. Many of them are involved in research, multiple other staff personnel that help us to do this.
Well, you have a great team, and I'm sure you're a great leader. Every team needs a great leader, so I'm sure you're doing a great job, and you're very humble. Dr. Winner, can you just tell us quickly, what is the age range that you see of patients that come in to see you? What is that range approximately?
We see all adults, but the age range for the memory disorder patients is really primarily 55 to 90. That's the group that we're focused on, that we feel that if we can make the diagnosis early enough, we can make significant changes and benefit. Although we see all ages, with, again, the Palm Beach Neurology has coverage of all neurologic disorders. my focus right now has been primarily with regard to memory. But the key issue here is people need to understand that they have this feeling that memory loss is normal for aging. It is absolutely not normal. Short term memory loss is not a normal process of aging, period. And dementia is not a normal process of aging. Yes, there is some decline. It's a little harder to learn as we get older, some things. And there is a little bit of some memory issues. You may have to think a second to get a word out, but it should not be progressive. And that's the key issue. These neurodegenerative disorders like Alzheimer's, they start 10 to 20 years before people actually realize something's wrong. And they're often not diagnosed for 4 to 5 years while people have significant neurologic problems. And that doesn't have to be the case anymore. All you have to do is get to a center like ours, get free memory screens, get a yearly neurologic checkup for your memory, and do this also for other medical issues. And you're able to control this and prevent it even without the fancy medicines that we are studying. You can actually get ahead of this and get in what I call the queue so we can use pharmacologic and non-pharmacologic medicines and non-medicines to prevent and fight this horrible disorder that we now do have treatments for.
You know, I'm really glad that you said it's not necessarily a normal part of aging, and it's something that, you know, if we can get ahead of it, you know, what would be some things that we could do to maybe take preventative care as far as, I know you said you have screenings and whatnot, but what are some things that one could do to get ahead of the game with these types of illnesses?
One of the easiest things to do to get in front of dementias, and specifically Alzheimer's, is get a hearing test. If your
Really?
hearing is starting to be impaired, it's one of the easiest things you can do is to basically get that corrected. Another is get your vision corrected. Input to the brain is very, very important. The other is blood pressure. If you control your blood pressure, and the goal is around 120 over 70 or a little lower than that, as long as you don't have any problems with, essentially people can sometimes get a little unstable if their blood pressure is a little too low or dizzy. But if you're able to do that, there are studies that have shown that that decreases the potential more than 15% of not getting a dementia such as Alzheimer's. So those are three really easy things to do. Could monitor your blood pressure, get it under control, and that's easy to check your
Yes.
hearing, check your vision on a yearly basis. And again, I can't stress enough to get a qualified, efficient, free memory screen. We do them, like you said,
Yep.
another number you can call is 851-9400, area code 561. We do
Mhm.
them all the time. But in our practice, our patients get them on a yearly basis from 55 and on, absolutely from 65 and on. You need to be doing this and get ahead of this. There's other things you can do. Obviously, control your blood pressure, avoid
Mhm.
diabetes.
Mhm.
Obviously, stop smoking if you're smoking.
Sure.
Exercise. Exercise has shown some data, mostly European data, about five times a week for about 30 minutes. That seems to be helpful. That data it's soft, but
Mhm.
it's surely not a bad thing to do. And again,
Mhm.
obviously, you have to be healthy enough to do that exercise.
Right.
But these are really simple things you can do. It's not costing any real money, so to speak. It's just a
Mhm.
matter of getting on a routine. Um, Diet is another thing. That's a little more complicated. Again, there's a lot of different diets out there, but most people can tolerate the Mediterranean diet. So if you start there, there are better diets,
Sure.
but if you start there, that's a simple thing you can do right now. For dinner
Mhm.
tonight, you
Mhm.
just go with a Mediterranean concept, which is a lot of fresh fruits and vegetables, is the basis of that diet.
Right.
So that's some simple things you can do right now. I didn't mention, but alcohol has to be monitored. You
Yes.
really can't have excessive amounts. It's not that a little bit isn't so, a little bit's okay, but you got to be careful with that.
If you could, Dr. Winter, could you explain a little bit more about what is the difference between Alzheimer's disease and dementia? Because I know that's kind of a confusing thing for some of us laymen, you know, in layman's terms. I would appreciate that.
Surely. I get that question almost every day.
Uh-huh.
It's a very common question. Dementia is a syndrome. It is not a diagnosis of a disease.
Okay.
Alzheimer's is a disease that is a type of dementia. So if
Mm-hmm.
we want to talk about dementias, there is basically vascular dementia, there is Parkinson's dementia, frontal temporal dementias, Alzheimer's dementia. These are the more common ones that we see, and there's a lot of others, but
Mm-hmm.
those are the more common ones. And what's amazing today is we can diagnose most of them using biomarkers.
Okay.
Basically, take a simple blood test,
Mm-hmm.
and now these are primarily done in research, but it's starting to become used in clinical practice.
Mm-hmm.
We're able to determine the presence of the disease. We can monitor this with treatments to see if we're getting a positive response. And this is with blood tests.
Wow.
So some of them are available right now at Palm Beach Neurology and Premier Research in the clinical part.
Mm.
Obviously, we've had this available in the research part for some time,
Mm-hmm.
and they're becoming much more affordable. There's something called C2N. There's something called ApoE, a type of genetic assessment that if you have ApoE4, one copy from mother or dad, you're about 3 times more likely, threefold increased incidence of this. So it's a genetic warning sign or increased risk. If you have both, one from mom, one from dad, then you're about tenfold more likely. And those two things, if people have those, and we test for that as part of our screenings. So we're looking to see these are the people that are more likely to get in trouble. About half the
Mm.
patients who have Alzheimer's have this gene defect. So you want to be looking for this. You do a free memory screen, you do this simple genetic profile, you watch these people closely. When they start to show some signs, you do some more biomarkers, and you give them appropriate treatments, both in or outside of research studies. This isn't tomorrow.
Right.
This is right this day. We do it every day at
Right.
Premier Research at Palm Beach Neurology. We've been doing it for a while, and it's going to get better, a lot better, quickly.
So it's interesting. Genetics play a role in how the disease presents itself. And so, what you're saying, if I'm understanding correctly, if we do the preventative measures, even though maybe we do have those genes that are present, we still have opportunities to be ahead of the game, eating healthy, keeping our blood pressure in check, doing all the things that you've recommended. Is that right?
Absolutely. Just because you have the gene
Okay.
does not mean the gene will be activated. So if you do things that do not trigger the gene, and we're still learning this kind of
Mm-hmm.
thing,
Mm-hmm.
um, you will be able to possibly push the disease off. If you take the medical treatments I've suggested and you use some of the newer FDA approved meds and the ones we have in research, what we do is we haven't been able to stop the disease of Alzheimer's. But what we have been able to do so far is we've been able to slow the progression. If we
Mm-hmm.
slow the progression, we about 27 to 30% is what we've seen in the new studies, and that's just in a year or a year and a half. And we see that over time, people continue to slow down as we continue the treatments. If we can
Mm.
do that, we can push the
Sure.
clinical symptoms of progressive Alzheimer's or progressive dementia, because that's what it is. It's the most common dementia in the United States.
Mm-hmm.
We present that clinical decline, we prevent it, and we
Mm-hmm.
slow it down. And then people can have many more years of high quality life with their family or do what they want to do. And this isn't things that were going to happen in the future. This is today.
Right.
So we've been pretty quiet. We've been doing this research for a long time. We've been
Mm-hmm.
pretty quiet about what we're doing, but it's now time to make the noise like these kind of programs. It's time to educate people. There's a lot of hope now. You're given the diagnosis of Alzheimer's. It's not what it was even a year ago. There should be a lot of hope. These people should understand there are a lot of opportunities. I had a patient just today.
Mm-hmm.
They came in, they heard about our center. They said, they were told by the physician that there's nothing can be done.
Hmm.
Well, that was true about a year or two ago, but that's not true anymore.
Right.
We have multiple options. I gave this person several options today that
Wow.
could be done.
Well,
So we need to get this message out, and this is across this whole country, not just on
yes.
our own community.
Thank you. We're going to take a quick commercial break, and when we get back, Dr. Winter, I want to ask you a couple more questions maybe on supplements and what kind of role that plays. So we'll take a real quick commercial break, and we'll be right back.
Surely.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back to another episode of You and Your Doctor. We have Dr. Paul Winter. He is at 4631 North Congress Avenue, Suite 200, West Palm Beach, Florida, 33407. He can be reached at 561-845-0500. The website is palmbeachneurology.com. So, Dr. Winter, a lot of people want to know, we're buying supplements, we're thinking, we want to take care of ourselves. Is there a role that supplements play in when it comes to Alzheimer's or dementia? Is there any type of correlation?
The key with it is to get the right diagnosis. So
Okay.
somebody shows up and they describe, I'm getting more forgetful, I'm not as sharp as I used to be. Is this the earliest signs of Alzheimer's, or is it something else? And this is where supplements can play a role if you have the diagnosis. The key is get the correct diagnosis. So when we do initial studies for patients or initial evals, we check their B12, we check their vitamin D levels, we check their folate levels. So these are very, very important for memory and normal cognitive function. So if someone has a very low B12 level, it could be that simple. That
Wow.
we just have to give them a B12 supplement, and in a matter of weeks, they start to become sharper. So we've already tested them, then we test them later, and we see whether it makes a difference. I wish I could say it happens all the time, because we
Right.
do see B12 deficiencies frequently, but it does happen sometimes, and that's a really nice fix.
Yeah.
To tell someone they don't have Alzheimer's, they just have a deficiency. Vitamin D plays a different role. Everybody's familiar with the aspect of vitamin D regarding bone function, to keep your bones strong or to avoid them becoming brittle. But the issue with vitamin D also is about the immune system.
Right.
And dementias, such as Alzheimer's, is a complicated disorder. It involves a protein called amyloid, which can be toxic, a protein called tau, which can become toxic, and inflammation. And your immune system must be in good shape to handle this. The medicines that we use today we need the immune system to work. We use monoclonal antibodies. We
Wow.
need the immune system to help us when we target these bad proteins so they can be removed properly and efficiently. The anti-inflammatory agents that are used in our research studies also require that the immune system help to remove these toxins, so people can actually think more clearly, and we can start to see that we can slow the progression of the disease and also as a preventant. So it does play a role. Stimulants, or I should say supplements, do play a role if you know they have a deficiency. There's a lot of controversy about vitamins outside of that if you haven't
Sure.
determined that there truly is a deficiency. But that's part of the initial workup of making the diagnosis. And you need to do that. In other words, make sure you're not on medications that are
Right.
affecting your attention. If you're taking medicines that are making you drowsy and
Right.
you can't pay attention, you are not going to do well with your memory.
So now you mentioned amyloid plaque. Is that something that builds up in our brains, or what? Can you explain a little bit more about that?
Surely. Alzheimer's is a genetically inherited disorder as we understand it.
Right.
The very first phase, and we're still learning, but the very first phase is the production of an abnormal protein called amyloid A beta 42 primarily. It's not the simple as I'm making it, but that's the key protein that's causing most of the trouble. So
Okay.
you produce this A beta 42. You produce this stuff 20 years,
Wow.
22 years before someone sees a clinical symptom. We can measure this now with PET scans, with spinal fluid, with serum plasma tests, blood tests. We can measure that this is going up 10, 20 years before a person has any clinical
Wow.
symptom that they're getting. That's why you want to catch this disease early. So that's the first part of the puzzle. And
Right.
it produces these things called oligomers. And these become nasty. They get in between nerve cells, they stop communication, they cause inflammation, they clump and form these things we call plaques. Those plaques cause inflammation. That inflammation causes cell death. The cell death results in the production of what we call phosphorylated tau. And the cells die and they're called tangles. In order to have Alzheimer's, you must have two things, two bad proteins, amyloid and tau. And the amyloid forms the plaques and the tau forms the tangles, so plaques and tangles. But there's inflammation going on too. Today, we attack all aspects of this disease through research. Ultimately, we hope that many of these meds will be approved rather soon because you will not be able to control this with just one single medicine. That is absolutely clear by all specialists that are working in this field. So, this is a process,
Yeah.
but amyloid is the beginning, and we can test for that presence early so we can monitor people. Tau comes a little bit later. Inflammation's occurring during this whole process. Cell death is when we really start to see the decline of the person. That's when they start to need help. That's when it's becoming obvious they're asking the same question over and over
Sure.
again. That's a decline. We want to catch people in those earliest stages, slow the disease down so they don't progress to what we normally see clinically as Alzheimer's. But this disease is present biologically 10 to 20 years before the clinical symptoms.
I've heard other doctors in passing mention, maybe on a podcast I was listening to or something, I've heard other doctors say Alzheimer's is what they're calling now type 3 diabetes. So is there any link between our blood sugar levels and having Alzheimer's?
Well, it's very interesting. The pathophysiology of it suggests it's not really type 3 diabetes. It's just a term that's used.
Yes, that I've heard them mention that. Yeah, as a term.
But there's clearly issues with metabolic function that is significantly impaired. But you bring up a key point. Diabetics have a much higher incidence of producing this amyloid more quickly and earlier in their life. They develop the disease a lot earlier. Their nervous system isn't doing as well. Their
Right.
immune system doesn't work as well to fight it. In fact, we are using some medicines that are used for diabetics now to decrease the inflammation. So many of the things that you're hearing that are being used for various controls of diabetes are in our studies right this minute. We're giving them to patients, not with diabetes, but Alzheimer's, to
Right.
help decrease inflammation. Now, if they happen to have diabetes, it helps that too, but that's not what we're doing. So that's, again, I mentioned there are multiple targets. There are 5 key targets we're going after.
Right.
And that's one of them. Neuroprotection,
Yeah.
anti-inflammation, get rid of this amyloid, get rid
Yep.
of the tau, and basically protect nerve overall function as in prevention.
Well, Dr. Winter, you're giving people a lot of hope. I know it's changed a lot from when I was younger, and my grandmother had this many years ago, so you're really giving a lot of hope. Before I let you go, can you just give us your final thoughts? Maybe some good hacks or suggestions or ideas that you can share with our audience.
Yes, happy to do so. I think number one, if there's someone in your family who has had a dementia, has memory problems, and you need to be, first of all, get them to a center who can do a thorough workup. And there are several in this area, several very good centers. You need to get them in. They need to be evaluated completely, efficiently, get an accurate diagnosis. If you yourself are 55 to 65 or older,
Yep.
and you have a history of Alzheimer's or dementia in your family, get to one of these centers. Control your blood pressure. Keep it 120 over 70 or lower. Exercise 5 days a week. And
Thank you.
get those free memory screens that are out there. Our center, you just have to call 561 851 9400. We do them very frequently if anyone wants them. Do it on a yearly basis, like you
Okay.
do anything else. Get your memory
Absolutely.
tested yearly over the age of 65, from 55 and on if it's in your family. Let
Right.
us get this diagnosis early, because you're going to hear a lot more in the coming next 6 months, year, 2 years, 3 years. What's coming in the pipeline that's in our office right now, yes, people need to have a lot of hope. It's
Wow.
looking very good.
Thank you so much, everybody. You heard it from the best, Dr. Paul Winter at 561-845-0500 right here at 4631 North Congress Avenue, Suite 200 in West Palm Beach, Florida, 33407. Thank you so much for sharing, Dr. Winter. We really appreciate you. Have a great night. We'll see